Students, in this video we'll be discussing about ethyl and methyl alcohols. So basically ethyl alcohol is nothing but aliphatic hydrocarbon which is having a hydroxyl group on it, which you can see here, and it is usually called as ethyl alcohol, which we are going to discuss today, or it's acutely called as ethanol. So we have types of alcohols which are malted liquors, which we have, or wines and spirits, which we usually know, rum, gin, whiskey, to be having 40 to 50% of alcohol in them. The actions of alcohol as such. So if we try to apply them on the skin, they'll cause a cooling effect because they'll be evaporating and they'll cause a cooling effect, but never and ever apply to the sensitive areas of the skin or even on the mucous membranes. It causes burning sensation over that. So if you try to inject it, into the skin, what happens is the area becomes inflamed and it becomes necrosed later. So never ever inject any type of alcohol inside the skin or any part of the body. If by chance if it gets injected around any nerve, it gets permanently damaged. The nerve supply will be permanently damaged and we can never ever recover it back. And also if we apply it topically, it has the property of shrinking of the proteins, shrinking of the surface proteins, so which we'll be using it for shrinking the bacterial proteins. So we do call it as antiseptic agent, because as it shrinks the bacterial proteins and kills them, we do use them in the form of sanitizers. We do use the alcohol in the form of sanitizers at different concentrations. Usually 70 to 90% is considered as antiseptic nature. The best antiseptic nature will be found at 70 to 90% of alcohol. So what are the effects on CNS by the alcohol? So ethanol is usually a CNS depressant, which depresses all the activities. 30 to 60 mg per dl of alcohol will cause us euphoria and excitation, which is in the initial phase. 50 to 100 mg per dl, it gives us something called as the high, which we experience, the euphoria. 100 to 150 mg per dl, it causes deteriorating and it causes mental clouding, disorganized memory and thought, and it causes altered gait also. So the police in drunken drive will be testing this, the altered gait. So 150 to 200 mg per dl, it causes permanent ataxia, the person cannot walk. 200 to 300 mg per dl, it causes the patient to go into unconsciousness, and medullary paralysis will cause respiratory suppression, ultimately leading to death of the person. What Darunan says about CVS is it's good for the love failures with heartbreak, but no, it causes atrial fibrillation, it causes cardiomyopathy, it causes QT prolongation on heart, on chronic alcoholism. And in blood, the Darunan says that it will reduce the LDL level in the blood, whereas it increases the HDL level in the blood, which is good for health, but it is applicable with the rule only and only if you take 1 to 2 drinks per day. If it is 3 or more, it will cause again the adverse effects. Also, Darunan doesn't know that megaloblastic anemia will be seen if the alcohol is consumed for a longer duration or longer time, because the folic acid absorption will be interfered. And for respiration, Darunan says if we apply it in the buccal mucosa or in the pharyngeal mucosa, it will trigger the respiration, which will help us in typical situations. But if the same alcohol goes into blood and just suppresses the respiratory system, it will cause complete collapse of the respiratory system. The body temperature, Darunan says that the alcohol makes the body of the person to feel warm, but the thing is, it causes cutaneous vasodilation. It will cause excessive heat loss from the body, which will be very dangerous at the end. And Darunan says for GIT, it causes increase in gastric acid secretion, so that he says it acts as an appetizer. Why can't you have it before food? But what we have to say is it increases the chances of getting acute pancreatitis also, and it also loosens up the lower esophageal sphincter, which is a bad thing that will be facing. Liver, Darunan will be telling that it will mobilize the peripheral fat, and so we have to say that as the liver will be in a continuous stress to metabolize the alcohol, it will go into something called as oxidative stress. Because of this continuous metabolism, this oxidative stress causes cellular necrosis, it causes cell death, and it causes fibrosis, which is leading for the cirrhosis of the liver at the end. So here Darunan says it relaxes the muscles. Once you feel the fatigue, you can just have some alcohol, you'll feel relaxed. But no, it will cause a permanent weakness and myopathy, the skeletal muscle related issues with chronic alcoholic. In the kidneys, Darunan says that it causes diuresis, but it does not affect renal function, that's true, but diuresis will cause excessive loss of water from the body, which will be ultimately deteriorating. 6. Darunan says that it decreases sexual urge, and it is an aphrodisiac, but on chronic alcoholism, it causes impotence, testicular atrophy, gynecomastia, and infertility. So we have to warn him not to get addicted to the alcohol. So how does alcohol work inside the body? As we know that it is a CNS depressant, all the properties of depressant like facilitates GABA activity, which will be depressing, inhibits NMDA activity, which will be depressing. It will leaves out the potassium so that the cell will be hyperpolarized, the neuron will be hyperpolarized, so it will be depressing. Inhibits the neurotransmitter by blocking calcium channels, so it will be depressing. Majorly, one of the mechanisms says it goes and stimulates the opioid receptors, which will ultimately lead to the release of endorphins, which will ultimately lead to the formation of dopamine, which gives us the mode of happiness. So that because of this feeling of getting euphoria and happy because of drinking alcohol, people will get addicted to it. So as Darunan was saying, in spite of having a few and tiny amounts of good things, but there are the adverse effects are overweighing the good things. So alcohol at all costs should be avoided. We should not be buying a lottery ticket worth 1,000 rupees just because we'll be winning 100 rupees out of it. You should see the risk and benefit ratio, right? So never follow Darunan's rules. Metabolism of alcohol, what happens is ethyl alcohol will be acted upon by alcohol dehydrogenase, which will be converted to acetaldehyde, aldehyde. With this acetaldehyde will be broken down by aldehyde dehydrogenase into acetic acid. This is what will happen inside the body. So contraindications: patients with peptic ulcer, as the gastric acid will be increased, lower esophageal sphincter will be loosened up. It is contraindicated in those people. Epileptics, the liver disease patients, they should not take it because there is chance of cirrhosis. Unstable mindset, people who will be not having a control over them should not be allowed to consume alcohol. Pregnant women especially, it will cause something called as fetal alcoholic syndrome, which consists of growth retardation of the baby, IQ, low IQ, microcephaly. There will be immune system impairment, and baby will be facing recurrent infections also. So what is the guideline for safe drinking? But nowadays WHO had advised that no drop, not even a single drop of alcohol is safe. But usually in older textbooks we used to see that one drink or 50 ml of spirits, the vodka, rum, gin and all, or 150 ml of wine or 100 ml of beer per day is found to be safe according to the older studies, but not now. Toxicity. What happens in acute toxicity? If a person starts drinking and he keeps on drinking in a single setting, so what happens is ultimately he'll be losing his awareness, he'll be having hypotension and hypoglycemia. Ultimately, if not treated, he'll be going into coma and death. So what to do? Immediately, if you are able to take him to the hospital, initially perform gastric lavage. Take out the alcohol which is present in his stomach, which is not absorbed yet. Then maintain the airway. Airway, breathing, circulation are the key strategies which we have to follow in the beginning. And CVS, then establish the IV line. We have to make the ABC, the C which establishes the IV line. Administer glucose first, because the liver will stop its functionality, and the capacity for the liver to synthesize glucose by gluconeogenesis will be blocked in this stage. So give it glucose. Insulin plus fructose co-administration will work. Thiamine should be re-administered because B1 deficiency will be always there with alcoholic toxicity. Hemodialysis at the end stage, it will also work. It will just filter out the excessive alcohol in the blood. So if the person is taking it for years together, if there is no time in his body where there is no alcohol, which means if he is always having the alcohol content in his blood for years together, he might go into dependence also. It might be psychological or physical. So what happens is many vitamin and nutrients will be failed to get absorbed, so that he might be facing polyneuritis, pellagra, seizures, Wernicke's encephalopathy, megaloblastic anemia, all these conditions because malabsorption will happen on chronic toxicity. So what happens if a person who is drinking for years together all of a sudden stops drinking? For example, he ordered a alcohol bottle. Store said that alcohol is closed today, we won't be delivering it. So what happens is initially he starts with anxiety, later the sleeplessness, he'll be facing hallucinations, delirium tremens, convulsions and collapse. So all of a sudden we should not stop a person who is drinking alcohol. All of a sudden we should never stop. So if that happens, what we have to do? As he was facing convulsions over here, so we have to give CNS depressants. Even if he doesn't have the convulsion episode, we should deal the situation because they have anxiety, tremors and all. We should deal with barbiturates, phenothiazines or chloral hydrate. The best thing, the gold standard thing is benzodiazepines. We have chlorodiazepoxide and diazepam in this class, which are absolute treatment point for treatment with chronic alcohol withdrawal syndrome. And we do have naltrexone, which is an opioid antagonist. In the mechanism of action, we have discussed that opioids releasing endorphins and dopamine is the reason for the pleasure, so that people are getting addicted. So if we give naltrexone, which is an opioid antagonist, they will not feel that pleasure again and again whenever they try to take the alcohol again. So in this way, if there is no pleasure, the person stops taking alcohol permanently. We have something called as Acamprosate, which is a GABA agonist and NMDA antagonist. It also has the same mechanism of action as alcohol. So when alcohol is not there, if you give this drug, the person's body will feel like it's already given with alcohol. So it has same mechanism of action like alcohol. So the persons will not take alcohol anymore because their body will already be thinking that he has already consumed alcohol. So this is how Acamprosate helps in the replacement therapy of alcohol when the person is in abstinence. Uses of alcohol. Okay, Darunand, let us make him happy for some time. If we apply alcohol on the intact skin of the person who is bedridden, it will prevent bed sores. It makes the protein aggregate on the skin, so the skin become tough, so that there won't be any bed sore formation. Also, we should not give it on the bed sore which is already formed. If there is a pain which is by trigeminal neuralgia or cancer pain which is not treatable, we can just inject this near the nerve so that the nerve will be permanently damaged. So in this way, we are using this adverse effect for our use, and is also found to be useful for normal common cold and for methanol poisoning. We'll see what is methanol poisoning in the next one. Disulfiram. We have seen that metabolism happens like this. So if we give disulfiram, it will inhibit this aldehyde dehydrogenase, so that this amount of acetaldehyde will be increased inside the body. So when acetaldehyde increases inside the body, it causes headache, tightness in the chest, burning stomach, visual blurring, fainting, circulatory collapse. All these kind of irritating feeling will be experienced by the person who is taking disulfiram. We should only and only prescribe this disulfiram for the people who are willing to quit alcohol, so that whenever they try to drink alcohol, they'll experience all these irritating feelings. We should not give it for a person who is not willing to quit alcohol, because he'll again go and consume lots and lots of alcohol and he might fell into the state of collapse. So only give this for people who are willing to quit alcohol. And we have something called as methyl alcohol. It is actually used as an industrial solvent for cleaning agents and all. It has no medical relevance for human. It is toxic, and if it gets mixed with ethyl alcohol, there will be some adverse effects which we'll be looking into them now. So just like previous, if methyl alcohol is acted upon by alcohol dehydrogenase, it becomes formaldehyde, and if formaldehyde is acted upon by aldehyde dehydrogenase, it forms formic acid. So what are the symptoms? If formic acid gets accumulated inside the body, the person will be having vomiting, tachypnea, dyspnea, bradycardia, hypotension. Remember like this: 2 up, 2 down, 2 up, 2 down, blurring of vision and blindness. Remember this, blurring of vision. So if blurring of vision happens, there will be like distorted images, so which gives us the treatment part, a mnemonic for the treatment part. Distorted images, this is one girl which is appearing like 2, because the treatment has all twins here. So already his retina will be damaged because of methyl alcohol. So don't let the retina damage further. Take him into a dark room and a quiet room, most preferably. Now do gastric lavage using sodium bicarbonate, because formic acid was formed. Here what was formed? Formic acid was formed. So in order to counter the acid, give a base, give sodium bicarbonate, and infuse IV sodium bicarbonate. Gastric lavage we should do with sodium bicarbonate. Also we should give sodium bicarbonate through IV to combat with formic acid. So this forms a twin. You can remember it like a twin of a treatment. And then we have alcohol, which is ethyl alcohol, which will be competing with alcohol dehydrogenase. So there is only one enzyme here, alcohol dehydrogenase. If we give ethyl alcohol over here, it will compete and take away this enzyme, so that this enzyme will not metabolize methyl alcohol, so it will remain as such. So this formic acid will not be formed. So inhibiting alcohol dehydrogenase is one of the ways. Also, Fomepizole is a specific drug which will inhibit alcohol dehydrogenase. So this drug can be given in order to prevent the metabolism of methyl alcohol into formic acid. So here also there is a twin where alcohol dehydrogenase is being inhibited. So there is a twin again here. Also give potassium chloride. If we keep on giving sodium bicarbonate, it might cause hypokalemic condition. So just replace the potassium chloride, that will be enough. Or we can remember as folic acid and formic acid. Formic acid, which is formed, this can be broken down by folic acid supplementation. So just give folic acid for formic acid. So we have 3 twins over here. Remember it. Last, hemodialysis might help. Thank you everyone. Hope you liked the video. Don't forget to subscribe to my channel. Thank you.